You can't quite call Darryl and Andrea Gladden high school sweethearts. For them, you have to go further back.
Junior high school, Andrea was in 7th grade and I was in the 8th grade.
The New Jersey couple were eventually married and had 4 children together, 3 daughters and a son. As their children grew older, all Darryl and Andrea ever wanted was to enable them to do what brings them happiness in life.
So the things that they really wanted to do, those are the things that we really paid attention to.
This desire to support their children at every turn has been magnified over the years, as all 3 of their daughters were diagnosed with lupus as each entered their teen years.
We had to readjust our whole lifestyle. So normally what you do with your children, you ask them, what do you want to be when you grow up? Or where do you want to go? Or what do you want to do? Those questions had surpassed us. It's like, okay, what are we going to do? How are we going to make this a simple, pleasurable life for all 3 of our daughters?
This is a story about finding joy in life's small moments. This is a story about accepting help when you need it most. This is the Gladdens' palliative care story. Lupus is a chronic autoimmune disease that can cause damage to the skin, the joints, and the organs. After seeing their eldest daughter, Danielle, deal with chronic pain and other symptoms before succumbing to the illness, Darryl and Andrea were determined to ensure that their other 2 daughters were able to enjoy the best lives they possibly could. Their second daughter, Daphne, lives a relatively active life while dealing with lupus, but their youngest daughter, Deadra, began to really struggle with the illness while in her mid-20s. In addition to severe pain, Deadra had suffered a stroke, was wheelchair-bound, and was on dialysis.
We were already set with the knowledge and information that we were given by the doctors that there was no cure for lupus. So we weren't expecting that, but we didn't expect for her to be in such discomfort. And she really wanted to know, okay, how can I live a normal life?
Hoping to help Deadra receive improved support for her pain, stress, and other symptoms, her primary care physicians referred her to palliative care. Now, palliative care is specialized medical care for people with serious illness. This type of care is focused on providing relief from the symptoms and stress of an illness like lupus. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a specially trained team of doctors, nurses, and other specialists who work together with a patient's other doctors to provide an extra layer of support.
We didn't really know about palliative care. We did have a staff of doctors who kind of referred us to palliative care, but we didn't understand it.
Deadra was 27 when she first met palliative care, and having been diagnosed at 14, she had spent nearly half her life dealing with severe pain that stemmed from the illness, but also as a result of multiple surgeries, like having her aortic valve replaced and gallbladder removed. Needless to say, this wasn't her first time sitting across from medical specialists, so naturally, she wasn't expecting much.
We were in a hospital with Deadra, and we were kind of like at a standstill. We had tried everything, every kind of medicine we could have tried, and the first thing they ask is, how can we help?
For the Gladdens, that simple question, how can we help, made all the difference.
Prior to that, Deadra did not respond, nor did she look at doctors, because we had been given so much information and none of it really worked. And once they came and introduced themselves to us, and when they asked that question, how can I help? We kind of like stopped everything, and Deadra looked up at them, and then she said, I want to get rid of this pain.
We remember it so well because it was like a big relief for us that there was a connection made with the hospital or a doctor or entity within the healthcare system. She became awoke, and there was some more hope to look forward to.
Another thing that they noticed is that the palliative care specialists were ready to listen before giving their advice and counsel.
It gave Deadra an opportunity to talk to them. It was like someone in her mind was like really asking me, what can they do for me, or how can they help me, or how can they make me feel better?
One of the first things that was really important was the bedside manner was the fact that there was a dialogue where it was going to be constructive communication going on.
Deadra opened up to the palliative care team about wanting to be more independent, about getting better control of her pain, and wanting to return to her hobby of writing. For the Gladden family, seeing Deadra finally become open to discussing her goals and wanting more from her care was a welcomed moment.
Really, it not only helped Deadra, it really helped us. It was a big help to us. Palliative care came in at a time for us when we were kind of like at the end of our rope. It's like we did not know where to turn from there, what to do.
For people facing serious illness, traveling to the hospital for appointments can be a chore. Recognizing that Deadra's symptoms made travel difficult, the palliative care team set up home visits where she could work with palliative care specialists who could help her deal with her symptoms, but also give her emotional support for the stress that all of this can cause on a person.
She came in and she visited her once a month. She came in, she would sit and she would talk to her. She would write out all the prescriptions that she needed. It was like a blessing for us.
Having support at home made a world of a difference for the Gladden family.
It was such a difference because we didn't have any of that for Danielle. We just basically did everything ourselves. Took her to all the doctor's appointments and everything. But for Deadra, it was really great.
Whenever a palliative care specialist would come into the home, the Gladdens noticed that the conversations no longer just centered around her illness.
They would sit there and they would talk about television shows, about foods that Deadra learned to cook and liked to eat. It was all about Deadra. It was nothing about me or Dad or other sisters or brothers. It was just all about Deadra.
With the lines of communication now open and with trust established, it was time to get Deadra feeling better. One of the key things that palliative care provides is consistent and specific pain management. The reason is because everyone has a pain story. For example, pain can affect one person facing lupus one way and another facing lupus in a much different way. So administering the same medication doesn't always do enough to address the symptoms. For Deadra, her pain affected her in many ways, including making it very difficult to sleep. Deadra's palliative care doctor, Dr. Marian Holler of Samaritan Healthcare in New Jersey, went to work on managing her pain, but also on giving Deadra more control.
The relationships that palliative care established with her, they were able to come up with Deadra's help a pain regimen that was less threatening to her going forward, but helped the best. But she had a sense of control about how it was going to be administered. So her and Dr. Holler were able to come up with a pain formula that she could administer, to help administer to herself, that was so much less threatening to her body going forward than they had at any point in time. And that was a big issue.
With a pain management plan in place, Deadra started to feel like her old self again. Her family was able to enjoy quality time with her as well.
Deadra was a writer, and Deadra went back to her writing after palliative care. We definitely know, as her mom and dad, we definitely noticed a huge difference. She went back to the book that she was writing. She was a better conversationalist. Her sleep patterns were much better. And I noticed that after palliative care came in, she was able to go back to doing things that she was really interested in, really conversate about things that she was interested in. She had more knowledge. She listened. She was more alert. And we thought, wow, this is great. This is our Deadra.
We were able to take her to church more often. Some of the smallest things for her to be able to do, just to be able to go in the bathroom and wash herself up a little bit, to, brush her teeth, to be able to go in the kitchen and get something out of the refrigerator. Those were big independent type things for her. Just be able to take her outside in the spring and just be outside. Take her to the movies.
Yes, and basketball games. Because my husband was a basketball coach for the ABA, and what we would do, we would take her to games, introduce her to basketball players. We used to like to take her out to eat. She used to like to go out to eat. Her favorite place was Red Lobster. And that's where she used to like to go. And we took her there. So in all, we got to spend a little more quality time with her and the things that really she liked to do.
You'll often hear that palliative care supports family members, but how exactly does that work? Well, in addition to providing emotional support to families, by simply giving the patient more attention and addressing symptoms and talking through goals, the palliative care team takes some of the responsibility off of the family. For Darryl and Andrea, who have been caregivers for so many years, that was huge.
It gave us time for each other. It gave us time just to sit and talk. And we knew that Deadra was with an entity that we really trusted. Like, we could trust her feelings with them. We could trust her conversation with them. And we were settled with the fact that they were not going to give her any misinformation. The palliative care doctors really took that out of our hands. They took that away from us. And it wasn't that they did knowingly. It was just the way that they practice, the way that they do business. They took everything out of our hands.
You know, it was so successful and so important to Deadra, palliative care. But she understood what palliative care meant to her and what it could mean to other people, not just the patient. She really understood how it helped us and helped the family.
And our conversation wasn't like at the dinner table or at lunch or whatever. It wasn't always about what could have been done, what should have been done, or what doctors, nothing about the doctors, because she had Dr. Holler. And that was great.
Deadra passed away in 2016 after 2.5 years with her palliative care team. To the Gladdens, their minds remain on the good times and the joy they saw Deadra experience throughout her life, even in the most difficult times.
When we realized how much or how important palliative care is to a life, it's basically indescribable, because technically it added really 2.5 more years to Deadra's life. And that gave us more time with her.
Darryl and Andrea now spend a great deal of time advocating for palliative care. While their second daughter, Daphne, hasn't utilized palliative care services, just knowing that it's there if they ever need it is comforting for the family.
We're really promoting like the palliative care way of doing things.
Yes.
If all doctors, you know, would operate in the way palliative care does and what they understand and know what's important when they deal with the patients, that is the thing that needs to be put out there, really, is the palliative care way.
To learn more about how palliative care can benefit you or your family, visit getpalliativecare.org.